Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, we're going to be discussing what medication I personally use to treat depression. So since starting this channel, we've covered pretty much every medication that people do use to treat depression, but today I'm going to talk about what I personally use. So the medication that I use to treat depression is called Bupropion, or Wellbutrin. This medication is kind of a new thing in my life, as I haven't always had depression. It's something that only started in the last 5 years after a diagnosis of bipolar disorder. Now, obviously being diagnosed with bipolar is an unfortunate situation to be in, but one positive about bipolar disorder is that you don't have to deal with depression for 12 months of the year. For myself personally, my bouts of mania and bouts of depression seem to go along with the seasons. Usually starting about mid-October all the way to March is typically when, if I was going to experience depression, is the time that I would experience it. So because of this, early October, I typically start off with 150 milligrams of bupropion each day in the morning, and then slowly increase it after about 2 weeks or so to 300 milligrams daily. When I first started using this medication, I would typically wait until the depression set in and then start using the medication, but unfortunately, then I would have to wait about 1 or 2 months until it really kicked in and the depression would go away. But now, having experience with the medication and knowing when my depression usually seems to come, again with the seasons, I start taking it before I feel the depression onset, so I can hopefully prevent the onset of the depression altogether. For a lot of people, when they start antidepressants, they can tell the physician what side effects they want to avoid, and the physician can prescribe an antidepressant for them that doesn't cause that side effect often. So for example, if somebody wants to avoid sexual side effects, they may try fluoxetine. Or if they want to avoid weight gain, try a different medication that causes less weight gain. For myself, my decision was kind of made for me because I had to make sure that I chose an antidepressant that would be less likely than others to cause mania. Bupropion seems to push people into mania only 3% of the time, so it was a good choice for me. I've been very fortunate with this medication in the sense that I haven't really experienced any side effects with it, so it is something that I probably will use long term, especially like I said, when October rolls around. The first couple of years after being diagnosed with bipolar, I didn't really want to treat the depression. The mania was something that was very serious to me, but the depression I kind of thought that was just more of a circumstance of reflecting back on manic episodes. But after going through it several years, 5 years total now, I definitely do appreciate the depressed phase more, and I do take it more seriously. And after having used bupropion for the last 2 years, I definitely noticed that the medication does help a lot. The other reason I really wanted to start using an antidepressant is because after my third manic episode that is, and I moved into depression, I did start to have suicidal thoughts and suicidal ideation, which was very troubling to me. So luckily I was very open with my friends, open with my family, told them what was going on and what I was thinking. But we all definitely kind of talked about it and thought that the best thing for me would be to use a medication to help get through those tough times. I really have to say that after going through bouts of depression personally, it really did change my perspective on what depression really is. Going through school and studying depression, I never really appreciated just how tough, I guess it could be, just how hard it could be on your body. I noticed a lot of physical symptoms with depression, aside from just the thoughts and the mental kind of acrobatics you have to play to try to get yourself through a normal day and live day to day. There is a lot of fatigue associated with it. You lose that drive to kind of get out of bed in the morning and start the day. And really your whole outlook on life really shifts. It's definitely not something to take lightly. So I am very thankful that I have this medication to use moving forward into the future. I will say that having suicidal thoughts or suicidal ideation is really something that I don't want to experience again, as it is very scary. So hopefully using bupropion in the future will keep me out of those bouts of depression, and I can just live my life normally through the winter months. Aside from using medication, there are 2 things that I do try to do to help treat depression while I'm experiencing it. You really feel like isolating yourself and not being social when you're going through bouts of depression. So there are a certain few people in my life, like my sister, my brother, my aunt, my father, that I do feel very comfortable going around when I am feeling depressed, although they will usually have to force me to do it. But going with them and being social and talking through my feelings does seem to help a lot. And then the other thing that I like to do is to see a psychologist, and just talk through my thought process and kind of pinpoint where the negative thoughts are coming from, and really focus on all the positive things that I do have in my life to look forward to, especially after the bout of depression has passed. That's all I really have to talk about today with what I use to treat depression. Again, Bupropion or Wellbutrin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found this information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.